Imagine if turning on the right kind of light each morning could nudge your brain toward better sleep, steadier energy, and a brighter mood. That is the promise of bright light therapy, or BLT, and it is more than just a winter hack. It's an actual treatment. I'm Dr. David Danish, a double board certified psychiatrist specializing in treatment-resistant depression and seasonal depression. And today I will show you exactly how I use bright light therapy safely and effectively for depression, including how to approach it if you live with bipolar disorder. Stay with me until the end because I will share my exact morning routine, the specific light boxes I generally recommend for my patients that you can read about and buy on your own. And this is all a free resource in my Mind Vault at drdaviddanish.com, and I'll put that link in the notes. Light is not just something you see with your eyes. It's a daily set clock signal for your brain. Your internal clock is like a smartphone that drifts off time unless it syncs each morning, and bright morning light triggers special retinal cells that talk to your master clock and mood circuits, helping you wake earlier, sleep more soundly, and feel more even-keeled. Irregular or insufficient light can push these systems off rhythm and make mood symptoms worse, which is why consistent morning light is so powerful, and which is also why I see a lot of seasonal depression where I live and work in Pennsylvania. Bright light therapy is not only for seasonal depression or seasonal affective disorder. A recent meta-analysis in JAMA Psychiatry found that adding bright light to usual care for non-seasonal depression doubled the odds of both remission and response, with benefits showing up within 4 weeks and continuing to grow after that, and without any added side effects. In practical terms, if you are already using medication and/or therapy, bright light therapy is a high-yield add-on that can help relief arrive sooner and build over time without major downsides. Now, our brain's light sensors respond best to bright, broad-spectrum white light delivered safely. Blue light is not bad per se, but blue-only devices have not proven better than standard white light boxes in head-to-head comparisons when looking at treating depression. All that means is a well-made white light box remains the reliable choice. The bottom line is to choose a 10,000 lux UV filtered white light box with a large screen and a sturdy stand, and to prioritize comfort and placement over gimmicks. The routine that helps most people with depression is very simple and repeatable. Use your light box every morning within 36 to 60 minutes of waking, because that timing advances your internal clock and aligns sleep and mood signals. In other words, it's perfect for your circadian rhythm. Sit at the manufacturer's recommended distance, which is often over a foot away, and again, go for that 10,000 lux brightness, and keep the box slightly off to one side so the light enters your eyes indirectly while you're able to read, eat breakfast, talk to someone across from you. Aim for 20 to 30 minutes at that 10,000 lux power, and if the device is a little bit lower at 5,000 lux, plan for 40 to 60 minutes instead. Commit to daily use for at least 4 to 6 weeks before you decide if it's working or not. Benefits tend to emerge around 4 weeks and improve beyond that initial period of time. This is not something you do as needed. It's an everyday habit akin to eating, akin to exercising. A note on bipolar. Bright light therapy can definitely help bipolar depression, but timing and dose require significant care. Evidence shows significant antidepressant effects in bipolar depression, with signals that intensity of at least 5,000 lux and careful attention to timing and duration matter. The reason for this is this can flip some patients with bipolar disorder into manic episodes. The safest path is to coordinate with your prescriber, make sure mood stabilizer coverage is optimized, and start with about 15 to 20 minutes at 5,000 lux in the late morning or midday, and only shift earlier if your sleep remains stable and no hypomanic symptoms appear. If you notice early switch signs like decreased need for sleep, racing thoughts, higher impulsivity, faster talking, sudden increase in goal-directed activity, stop light therapy immediately, and of course, contact your clinician promptly. Now, bright light therapy is usually extremely well tolerated. Again, the bipolar risk is there, and the most common side effects are very mild, like eye strain, mild headache, temporary jitteriness, And those usually resolve if you keep doing it every day, or if you make your distance between yourself and the box a little bit farther, or just lessen the total minutes per morning until you get used to it. Of course, if you have retinal disease, had recent eye surgery, or take medications that make your eyes more sensitive to light, take that all into account. Certain antibiotics, certain anti-acne medications, anti-arrhythmics for your heart, those can also make you more sensitive in that same way. So make sure to talk to your providers about that. So when in doubt, begin conservatively, observe how you feel over the first week, and adjust duration and timing rather than abandoning altogether. Think of bright light therapy as the metronome for your brain's daily symphony. Musicians use a metronome so the whole band stays in rhythm, and your brain uses consistent morning light, so sleep, energy, circadian rhythms, and mood keep time together. When the metronome is steady, the whole performance sounds better. And when morning light is steady, your day tends to run so much smoother in all regards. Once again, click on the link to go to my Mind Vault, and I'll list a few different manufacturers that provide 5,000 and 10,000 lux offerings with a large light box that you're gonna set at least a foot away from you. This will make it easy. It's a no-brainer to try if depression is something you're struggling with and you're not too worried about having bipolar that easily switches into manic symptoms. Remember to let morning light, if it's available, do some of this heavy lifting for you as well, and I'll see you in the next video.